Good afternoon. Welcome and happy spring. I'm Cara Dean Assail with the Community Technical Assistance Center at the New York University School of Social Work, Silver School of Social Work, McSilver Institute. And I would like to welcome you to today's web-based training called Internal Family Systems Therapy, an overview and best practices with Hart Haraguchi, a licensed mental health counselor. Internal family systems therapy. Have you heard of it? It's also known as IFS. It's an evidence-based, non-pathologizing psychotherapy treatment model. It was actually developed by Dr. Richard Schwartz in the 80s and is used to help with a range of mental health conditions, including anxiety, depression, eating disorder, PTSD, and substance abuse. It can also be used to address common concerns that often present in treatment, such as low self-esteem, anger, and shame. Today's webinar is going to provide you an overview of the IFS model and offer several therapeutic practices to consider utilizing with your clients from the age of 10 and up. Before we get started, though, I want to take a moment to orient everyone to our Zoom webinar system so you know how to participate in today's event. This may be a repeat for some of you, so I apologize, but just know that upon joining, you are placed on mute to avoid any background noises. If you come across any technical issues today, please chat to our host, Connor, who will be able to assist you. You will have the opportunity to submit questions for the Q&A portion of our presentation by chatting in, utilizing the chat box feature, which is located on the bottom panel. You can also use the Q&A button, but most of our communication will be happening in the chat box, so please use that at your leisure. And you can chat in questions at any time. I will be capturing them and putting them in a document for the end of the presentation. And for the best viewing experience, you can go to the top right corner and click View, and then click side-by-side :speaker. That will be your best viewing experience for today. Many thanks to Hart Haraguchi for presenting today. Hart is a licensed mental health counselor, associates specializing in trauma and grief work. She is an IFS level 2 trained therapist and a certified grief counseling specialist. She also writes for Choosing Therapy, focusing on providing information about trauma, grief, and life transitions in an accessible and straightforward way. I will now pass it along to you, Hart, to get us going. And for your presentation, we thank you so much for joining us.
Thank you so much. I am so happy to be here with you guys today. So Cara has given a really good overview of what it is that we're going to be covering. So we're going to start with the briefest history and overview of what IFS is. We're then going to go ahead and look at the two foundational paradigms that are forming the basis of this particular model. And we're going to define the key terms that we need to know in order to talk about and really work within it. And then we're going to look at the process of using IFS with an actual case study, so you can see how the process might look with a real client as opposed to just in theory. And then to wrap it up, we're going to learn an intervention called the 6 Fs, which is one of the key interventions that's used in this model. And of course, we're going to save time for some questions at the end. So we can go ahead and dive right in. Internal family systems, as Cara said, was developed by Dr. Richard Schwartz in the 1980s. And he had trained as a family systems therapist and was working with clients who were having eating disorders. And he started to notice in his sessions that clients were describing almost like there were other people who were making them do things that they didn't want to do, like binging and purging. And he found that when he started to really tune into those parts, something about them would start to soften back, and he would see the clients come to a place that was a little bit more centered and calm. And he got really curious about what was happening there. And so he also noticed that those parts, there might be one part who felt really strongly about binging, and then there might be another part that felt really strongly about purging. And he was noticing that there were relationships between the parts of a client that reminded him of the way that family members interact with one another in an actual family setting. And because he was really influenced by structural and strategic family, as well as Satir and Bowen's work, he was really starting to track the patterns and sequences that were happening. And so that all started to inform his development of IFS from these observations that he was making initially in this practice of family therapy. He was also influenced by Gestalt therapy, using that concept of the empty chair technique, where you sort of embody different energies and communicate across. And so that all ultimately came together into what we now know as IFS. And in 2015, it was designated as an evidence-based practice, and it's become an increasingly popular mode of therapy because it resonates pretty naturally with a lot of people, and is a really wonderful way to help clients get a little bit deeper into their own systems. So given that, who is IFS good for? The short answer is essentially everybody. There are therapists using IFS with clients of all different ages, all the way from very, very young children up to geriatric clients. And they're also doing it in different configurations of treatment. So you've got people working with individuals, couples, and families. In this particular presentation, we're really going to focus on working with individuals over the age of 10, because this is just an overview, and there are special considerations for working with very young clients or working with couples and families that we won't have time to get into. So we're going to focus on individuals over the age of 10. So for those individuals, what can IFS be used to help with? So most of the major diagnoses that we tend to see as clinicians respond quite well to IFS. So things like anxiety and depression, trauma, substance abuse disorders, eating disorders. There are also clinicians who are using it to work with really severe presentations of OCD as well as DID, and there's ongoing research into the efficacy and best practices around that. IFS is also useful for clients who are dealing with chronic pain or chronic illness. One of the earliest studies that came out about IFS was actually looking at using it with clients who experience rheumatoid arthritis and dealing with the pain that comes from that that doesn't respond well to medication. So that's a little bit of an offset of a way that it's being used. And then, of course, all of those issues that we tend to see with clients in therapy, but aren't necessarily diagnoses, things like anger, suicidal ideation and self-harm, self-esteem and self-concept issues, and shame. So it's a whole range of things that there's all kinds of ways to use IFS to help clients work with that in a way that's safe and effective. So what exactly is IFS? There are two paradigms that are really the foundation of this model of therapy. And the first one is this concept of multiplicity. So in IFS, the mind is being viewed as naturally made up of many different subpersonalities. So typically when I introduce this, a lot of people tend to jump towards the idea of having multiple personalities or dissociative identity disorder. And while that is on sort of the extreme end of the spectrum, IFS is viewing multiplicity across a whole spectrum. So we all fall somewhere along it. And IFS is suggesting that we are sort of just naturally made in this way. And we can see this even just in our everyday language. Like I'm sure all of us have said something along the lines of, oh gosh, I probably should get out and have a walk today. The weather's good. It would be good to move around. It would be good to have some sunshine. But there's this part of me that just really wants to sit on the couch and do nothing. And so we've got that piece, right? There's that part of me that wants to. We've got all of these tensions and conflicting thoughts and feelings that are going on within us. And IFS and the idea of multiplicity is a way to engage a lot more deeply with that aspect of being human. And it also allows us to look at thoughts and feelings and behaviors without pathologizing them, because when we see things coming up that aren't necessarily serving the client, as opposed to assuming that there's something wrong with them, we're assuming that that behavior is coming from a part that is trying to act in the best interest of the client, but it's either burdened or overactive in some way. So we can get really curious about what that behavior is serving, as opposed to sort of seeing as the person as being wholly caught up in that behavior. And the second paradigm that we want to take a look at is this idea of systems thinking. So Dr. Schwartz was trained as a family therapist. He was steeped in the whole idea of systems. And so his idea is that the parts of ourselves, the internal parts of ourselves, can interact with one another in the same way that family members in an external family system are able to. So the idea of alliances, triangulations, polarizations, cutoffs, all of that can happen between the parts that are in our own system. And he also focused on this idea of differentiation being really important to keeping the system healthy, really wanting each of the parts, just like we would want each family member in a system, to really be able to be their full selves and bring all of that to the table. And so with IFS, we're both working with and within the system, the idea of multiplicity sort of being the overarching piece of that. So with that covered, we're going to spend a little bit of time looking at the specific terms that we really need to know in order to work with this model. The first one is self. And I think you can see on the PowerPoint that self in this model is designated with a capital S. And it is the purest essence of who we are. It's what we come into the world with. That's really that sort of core of our humanity that we have all of the time. The idea here is that self is always whole. It is always intact. We can't get rid of it. We can't harm it. We can't damage it. It might appear sometimes like people don't have access to their self. It might get blended or covered up by other parts, but it is always there. And self is also the natural leader of the system. When we have a self-led person, all of their parts are following that. And the self is what heals them and allows them to be fully integrated into the system. So if you think about like an orchestra for a second, like you've got this idea, there's all these musicians out there, and then you've got the conductor who's sort of overseeing everything, holding the whole picture and able to communicate with everybody in it. That's like that self part of ourselves. And so if there's an issue that comes up, it's the self who has enough distance to be able to see what it is that's happening. And so the next slide, we're going to look at, so how do we know what self is? So Dr. Schwartz coined the 8 C's, which are the qualities of self-energy. And when we notice these coming up in ourselves or in other people, it's a clue that there's self-energy that's present. So he identified these as calmness, compassion, curiosity, connectedness, confidence, courage, creativity, and clarity. And there are probably a lot of other words that don't start with C that might indicate self-energy. So often there's a real sense of spaciousness, there's a sense of peace, and there's a sense of lightness that people have when there's a lot of self-energy or when they're a self-led person. So we can feel that, we can notice that in our own selves, and we also tend to notice it in other people. And so if you think for your own self about a time when your self-energy was really present, people sometimes describe it as feeling very plugged into the world, very in their bodies, very grounded in reality, but still holding things a little bit lightly. So the other aspect to the internal system is parts. And like I said earlier, these are the naturally occurring subpersonalities that help make up who we are. We come into the world with them or with the potential for them. They're not born out of trauma. We come with them already, and they all come with their own natural gifts and qualities and talents. And they are serving as a resource for our self-energy to be able to really be and act in the world. If we were all purely in self-energy all of the time, we might all just be sitting under a tree and thinking about how wonderful it is to be alive, but it would be really hard to do things like remembering to brush your teeth or, send that email to your boss. So we need parts to take those actions for us with self as the leader. And so the idea here is that parts are not a new thing to IFS. There are other models of therapy that have identified the concept of parts. So for example, we've got archetypes in Gestalt therapy. We've got ego states from psychoanalysis. We even have schemas like from CBT, the idea that we've got these sort of repetitive thoughts or patterns that are showing up. In IFS, we just name them parts, but it's not necessarily a unique concept to IFS. It's just how we're working with them that's a little bit different. So in IFS particularly, we're seeing parts as having their own discrete and distinct identities. So they've got their own beliefs, values, points of view, goals, and these may or may not be all aligned. So you can have a part, for example, that really values exercise and outdoor time, and you can have a part who really values sitting and doing nothing. It doesn't have to be, all parts have their own kind of way of seeing things. And when clients are getting in touch with and experiencing their own parts, they might find that those parts are not the same age or gender of the client who is actually sitting in front of you. If you think about the idea of inner children, which is a version of a part, then we've got the idea of like it's us, but at a younger age. And so I've had a client who was a 12-year-old girl, but she had an 80-year-old male part. And so how they look and how they identify doesn't necessarily have to match up with the physical body of the client themselves. So the way that parts show up is different for different people. They might show up as thoughts, such as if a client is saying repeatedly things like, I just feel like I am so worthless. I don't know why anybody is friends with me. Like, what do I even bring to the table? There's sort of these thoughts that are coming up. We can identify that as a part and get really curious about, okay, so that part of you that thinks those thoughts, let's look a little bit deeper at that. It can also show up as feelings, sensations, or memories. And some clients will experience parts as very clear sort of visual images, almost like they're watching a movie in their mind, or they've got inner voices that they can almost hear different voices in their own mind. We can also see it as behaviors, impulses, or urges. So there's a lot of different ways, and we want to be curious, especially when we're just starting with IFS with a client, about how they show up specifically for that client, because people can experience it in really different ways. And so there are some clients who don't love the idea of parts or aren't quite comfortable with that language. And so in that case, there are a lot of different ways that you could approach it. I have some clients who prefer things like that piece of you or that side of you, maybe even that version of you. And if that still isn't quite resonating for a client, simply calling it what they call it, that thought that you have, that sensation that you have, that impulse that you have, and getting curious about that. So all of that said, on our next slide, we can see that all parts have self-energy at their core. They're all bringing those sort of 8C qualities into how they are, and they're all able to connect to the core self of a person. One of the most important tenets of IFS is the idea that there are no bad parts. We might have parts that are acting in ways that are upsetting. They might be causing pain to the client, but they are at their core not bad. There's no such thing as a bad part. There's only bad roles that parts find themselves in. And so we want to assume always that a part has positive intent for the system that it belongs to. Its actions are always in service of keeping some safety or some stability at play for the system. And so it might not look like that, but we want to remember that, because that is what allows us to stay really curious and open to what's actually happening for parts. So let's get a tiny bit more specific here. There are 3 kinds of parts that we are typically working with in IFS. And the first type we're going to look at is exiles. So as I'm talking about this, you might even notice for your own system, what kind of pops up as I'm talking about this. Does anything sort of trigger in your mind of like, oh, that sounds familiar, or, oh, and as we're talking about this, I'm noticing this sensation or this emotion coming up. And just allow yourself to attend to that a little bit, because as we get to know our own systems, it allows us to work with other people's systems in a better way. So exiles. These are the parts of the system that have been shut out of the system, and they're carrying the most intense thoughts, emotions, memories, or beliefs. And it's very often the exile parts that are holding the memories of really traumatic experiences. And they tend to have the beliefs of things like, I'm worthless, I'm unlovable, the world is absolutely an unsafe place. They will often appear as child parts. They will quite often appear quite young, but a part can be exiled at any time across the lifespan and isn't always necessarily appearing as a young part. And exiles often come up in response to trauma, attachment wounds, or those experiences that create a great deal of humiliation or devaluing of the person's humanity. And when that happens, the exile parts are often sort of stuck in that time. So if you've ever had that experience of, something reminds you of something really negative that happened in your life, and all of a sudden you feel like you're 5 years old again, you know that you're not 5, but there's a part of you that doesn't. There's a part of you who feels like, oh my goodness, I've been here before. I know what this is. It's because we have those parts that get frozen in time to the time that they got exiled. And so in response to the immensity and the intensity of the pain that those parts are holding, we have other parts who show up who are trying both to prevent that exile from experiencing more pain and also trying to prevent the system from being overwhelmed by the exile's pain. Like all systems, there's that aim for sort of homeostasis or balance. And so the intensity of what the exiles are bringing can feel really threatening to the system overall. So we have these protector parts, and there are 2 types of those. The first is our manager parts. These are those parts of us that tend to be really responsible for getting us through our daily lives. They tend to act in really socially acceptable ways. They have goals and values that are really aligned with the society and culture that the client is a part of. And they'll often appear really quite self-like. When these parts are healthy and acting in their natural roles, these are the parts that help us with things like motivation, organization, persistence, execution of things that are important to us. But when they're trying to protect an exile, or when they're burdened by something themselves, they can come across as really critical, really rigid, a lot of perfectionist tendencies. So many people, their first encounter with a manager part for themselves is that idea of that critical voice in your head that is always saying things like, you didn't really do a very good job with that, or you should have tried harder for that. Why didn't you prepare more for that? This is often a manager part that has taken on a role that it views as being really helpful, but isn't truly how it naturally wants to be. And the key part of understanding how managers work in our system is that they are proactive in their efforts to keep everything stable and in control. They're really worried about the system getting out of control or becoming overwhelmed. And so they're doing everything in their power to keep everything going fine. When that fails, we have these other protector parts who get activated. And these are called the firefighters. So in their natural and healthy roles, our firefighters are those parts that help us to really let loose, have fun, be in the moment, try something new, be spontaneous. But these are also the parts that when they're protecting an exile, or when they're holding pain themselves, they're going to get triggered or activated by something, and they will do absolutely anything that they can to decrease, diminish, disconnect, disassociate the client from the pain of what it is that's coming up for them. These parts tend not to act in ways that are socially acceptable. So when those parts take over, we tend to see a lot of behaviors like suicidal ideation or attempts. This is where we see substance use coming in, other violent behavior. And it can come across really as quite scary, because it seems like there's a part that's acting without any regard for the client. And yet their goal is protecting the client from the pain at all costs. So the cost of their behavior is not high enough to deter them from the actual pain that they're trying to protect the system from. And because there's a lot of different approaches, clearly, that managers and firefighters have, people often have a lot of conflict in between these 2 parts. And so just like we talked about earlier, I'm sure for your own version of, should I go for a walk or should I sit on the couch? Those parts can really kind of be at war with each other and cause a lot of inner conflict and tension for the person who's trying to navigate between these 2 who have the same goal, but have really different ways of approaching it. And so the last term that I want to look at here is burdens. And I've mentioned it a little bit as we've been going, but IFS, and for IFS, the burdens are the really extreme beliefs, feelings, sensations, or memories that a part is holding. And it's typically the exiles who are holding the heaviest of those burdens, but any part can hold a burden, including the protector parts. And when a part has a burden, they aren't really able to embody and act from their natural way of being. That spark of self that they have tends to get kind of covered up. And so a part of IFS is helping those parts to release their burdens in a process that's called unburdening, and then taking back in all of those natural qualities and gifts that they've got and being back in full relationship with the self of the system. And when that happens, the exiles are able to reintegrate into the system. They're no longer exiled. And then the protector parts are able to relax and take back on their natural roles because they no longer are in this position of having to try to keep all of that pain at bay. So I know that's a lot of information. I want to take a quick look at what the goals of IFS are and then take a few questions to make sure that we're all on the same page. So we've got three big goals when we're talking about IFS. And the first and most important goal is connecting a client back into their own self-energy. So a lot of times when clients come to us, they're not always able to access that self-energy. It's gotten covered up by a lot of things. And so we first and foremost want to really be able to connect them into that. And then once we've got some self-energy on board, what we want to support is the relationship between the client's self and their parts, because this is where the healing happens. It's not the therapist who's healing the client, it's the client's self who is healing their own parts, which brings healing into the whole system. And then we want to start. So once we have that relationship in place, what we want to do is help the client's self to unburden those parts and reintegrate them with self very much at the center and sort of leading the whole system. So if we can just take a quick pause, how are we feeling and what questions do we have?
Thank you, Hart. We do have a few questions that came in around the IFS, this first part. So let's take a few of those if we can. One is, do we gain and lose parts over time?
No, we come into the world already with our parts either fully present or the potential for them. We don't ever lose or get rid of them, and we never are trying to get rid of them, only trying to fully integrate.
Got it. Okay. Integrate them into the self?
Into the system.
Into the system, which is what? That's not the self.
No, the system is self plus parts.
Self plus parts. Awesome. Okay. How do you differentiate between the parts and something like DID, dissociative identity disorder?
Yes. So from the IFS perspective, DID is just a very extreme version of the self being covered up or too blended with parts. And so from this perspective, we wouldn't, that presentation of DID wouldn't be considered a pathology. It would just be considered an extreme of how we all naturally are. And so the way that people work with that particular presentation is the same way that we would work with clients who do not have that presentation, where you start first and foremost with working with whatever part is coming up and sort of helping the client get to where they are and seeing what it needs in order to soften back so that the self-energy can start to come forward. It's a much more intense and often quite a bit longer term of a process, but it is essentially the same process.
Great.
Does that answer that question?
Yes.
Okay.
Thank you. Does IFS work for people kind of along the same lines, but maybe different? Does IFS work for people who repress emotions and seem to not be able to remember periods of their life?
Yes. So when we've got people who are repressing emotions or have, missing memories, what that means is that there is a part of them that is keeping those emotions in check or is keeping those memories out of their conscious awareness, and for good reason, right? When parts are doing that, we're trusting that there's good intent for that, and we want to follow that client system. So you start first and foremost with what part of you is so concerned about letting some of those emotions come up? What are you afraid is going to happen with that? And really getting to understand why the part is acting in the way that they are, and building that self to part relationship. And over time, as that relationship strengthens, that part is able to relax and let those emotions or those emotional parts come forward. A similar thing with memories that are missing.
Great. Well, thank you. Okay, we have a lot of questions coming in. We might not be able to get to all of them, everyone, just so you know, because there is a whole other part of this webinar.
Yes, we're halfway.
Someone is asking, how much of this terminology do you have to go through with clients before beginning work, especially when the client is a child?
Almost none. I personally, and most of the colleagues that I have, we don't tend to give a whole lot of psychoeducation about this. There are clients who have parts who really need to know ahead of time. That's sort of what allows them to soften. But for most people, when they come in and the pain is the way that it is, we just sort of jump in. And we'll get to that a little bit later in the presentation, well, sort of the process of introducing that, but typically very little.
Okay, so another question is what to do if a client's inner critic is very strong when the client tries to connect to the self?
Yes. So we would want to know why. What is the concern about letting that self energy come through? And when you've got clients who really are not able to access their self energy, there are some parts who are really covering that up and really, really reluctant to allow that. There's a slightly different way of work. We'll touch on that as well. There's a slightly different way of working with them that doesn't involve calling on the client's self first.
Great. Somebody seemed to join late. They were like, parts aren't emotions, right? No, they're parts, right?
Yeah, parts have emotions.
Mhm.
And we can conceptualize emotions as parts. So if there's sort of this, like for example, if there's that emotion persistently of feeling not good enough, we could conceptualize like, okay, so a part of you, their identity right now is not feeling good enough. Let's focus in and engage with that. But no, they might show up as emotions, but they're not quite the same thing.
Right. Okay. And somebody said, I thought you said earlier that we come with parts and they aren't formed by trauma. So we don't, so as I asked, parts don't kind of come and go throughout our life, but our parts can be impacted and often are by trauma, right?
Yes. So parts aren't born out of trauma, but parts can be burdened by trauma. And so when those burdens come in, that's where the exiling typically tends to happen because what they're now holding is too heavy for the system to bear at that time.
Right. Thank you. What would you say? Somebody was saying, is anxiety just the manager going haywire? What do you think about that?
I would have a lot more questions before I gave a definitive answer to that.
Okay. Yeah. People are trained, but by the way, everyone, people are trained for weeks to become an IFS therapist. So this is kind of like, just a real overview. So I love all these questions and, maybe something for y'all to look into in regards to the training. I really think it's a really valuable tool to have in our toolbox.
Mm-hmm. Mm-hmm.
Should we move on? We do have more questions. I'm going to add them, but maybe we should move on for now.
That sounds great. Yes, I'm hoping that as we're going, some of those questions will get answered, and any that don't, we can pick back up with those maybe a little bit later. Okay, so moving into sort of the second half here, just on these next two slides, what we're going to quickly look at is what the process of IFS is, and then we're going to delve a little bit deeper into that with an actual case study. So it's a little bit less theory and more kind of what's actually happened in real life. So at the very beginning, just like we do with all kinds of therapy, we want to just get to know the client. We're really focusing on understanding what has brought them in, what's going well for them, what's not working for them, what are they hoping is going to be different as a result of being in therapy. And then over the course of getting to know them, we're going to start listening for and introducing parts language. And so this tends to happen really quite passively, where once you hear it, it's hard to unhear it, but people are often saying things like, well, there's a part of me that really wants this, or there's a part of me that's really afraid of this. And so we start to notice and catch that language and say, something like, I hear you say there's a part of you that is is really anxious about this upcoming presentation at your work, I wonder if we could maybe get to know that part a little bit. And so if the client says, yeah, actually, I'd be interested in that, then we've agreed to work together in this way, and we're able to get into the next step, which is really identifying and working with a target part. And so that's going to look like saying, okay, so that anxious part of you, let's engage with that. And almost always, the parts that we're going to work with first are those protector parts. Those protector parts are so important, and they are doing such hard work. And we want to work with them first so that we can make sure that they're on board. So when we eventually go deeper into the system, they're not going to be like, oh my goodness, we have gone too far too fast, and we now need to way overreact in order to try to bring the system down and put that exile back in its exiled place. And while we're doing this part with the protector parts, this is where we're really going to start bringing in some self-energy and helping the client to sort of have those parts step back enough that their self-energy can really come forward. And so in the next step, what we're going to do is start to work with the exile. Once the protectors have a relationship with self and are going to trust that we can bring forward those really painful burdens of the exile, we're going to actually do that. And when we're working with exiles, there's a few things that we might do. We might sort of see where they are and offer to kind of bring them into the present, bring them somewhere safe. We might offer them a do-over. And all of this work that we're doing is happening inside of the client. We're not acting anything out typically. It's all happening sort of in the mind and in the body. And so once we've got those exiles unburdened, we're able to reintegrate them into the system. So that means sort of bringing all of the parts up to date on the changes that have taken place. And then we want to go back to those protectors and say, okay, now you can see that the exile isn't holding that anymore. Does that change maybe how you want to be, how you want to work in the system? And very often they do, and they're gonna give up their own pain, their own burdens, and they're gonna take back on their natural roles. And then completion is just the very last step. It's something that should happen every session, and then also at the end of the work together, which is just thanking those parts for showing up and thanking the client for engaging with them in that way. And the client will thank their own parts, and the therapist will thank them as well. So we're going to take a look at that very quick overview in a little bit more detail with this case study. So I have changed the name and some of the identifying details for this client, but this is a client that I worked with, and his name was John. He was 14 when I was working with him, and he was referred to me by his mom after he had been arrested for trying to buy alcohol with a fake ID. And in the 6 months prior to that arrest, he had been suspended from school twice, once for bringing alcohol and marijuana to school, and once for threatening to kill a teacher. And his mom had said prior to this, so it started when he entered high school, and then sort of was 6 months of a lot of things going on. And his mom said prior to that, he really wasn't this type of kid. He was a pretty quiet kid, but overall, happy, low key. He was really into art. He had a couple of good friends. He did fairly well in school. Just a pretty easy kid. And so when he got into high school, all of that really started to change. And his teachers were seeing something similar, where his report cards in middle school had always said, he's a good student. He's not the best student. He's not the worst student. He doesn't have any behavior issues. He's just kind of middle of the pack, flying under the radar. And then he gets to high school, and all of a sudden he's this problem kid. And so on the next slide, when we started working together, where I started with John was really just building up that therapeutic rapport. And so, like I'm sure so many of us who work with kids know, especially teenagers, that rapport, really building up that relationship, is so incredibly important. And in IFS, it's not a process that we want to rush, because we're aware of the fact that it isn't the client who is building a relationship with us. It's all of the client's parts who are observing, are we trustworthy? Can we hold this? What's it going to be like to be seen by this person? And so it can take a little while. And I was really patient with this process. We did a lot of art together in session. He was this really talented artist and he loved comic books and he had drawn his own. And so we really connected initially on what was important and interesting to him. And while we're in this rapport phase, I'm very, very conscious about my own energy with the client. I don't ever want a part to be in the driver's seat when I'm with a client. I want to be purely in that self energy, because self energy, it doesn't have an agenda, right? It's very open to what's happening. It's really engaging in this very present, very focused way. And so I was very conscious of that with him. And then just following his lead, knowing that we were going to get where we needed to go, but it needed to happen in his own time. And so as this is going on, I am listening all the time for parts language. And as I started to hear it, I started to reflect that back to him very much in the here and now. And so it would be things like, I hear that there's a part of you who really hates school, but I know that last week you mentioned that you're really loving your art class. So how is it to kind of be feeling both of those things? And getting a little bit more comfortable with this idea that we might be feeling multiple things at one time, which is a really natural way to introduce this idea of parts. And so my very brief version of psychoeducation for clients is typically something like, I've heard you say that there's a part of you who wants this and there's a part of you who wants that. Can you imagine maybe almost that those are like other people that we could bring into the room and get to know? And typically people are like, especially teenagers, people are like, oh yes, like, of course, that makes a great deal of sense. And so then we kind of go from there. And for John, the idea of using parts language was fine. So we talked about parts as parts. And so we had that curiosity about what was coming up for him. And we started to get to know the protector parts. And the first part that we met was this manager part who ran his daily life. This part was working so hard. This part was working overtime all of the time. And John named him the assistant. And so he felt the assistant, when we talked about him, he would feel it as sort of this pressure back behind his eyes and this tension in his hands. And so we got really curious about when that energy comes in and you notice it behind your eyes and you notice it in your hands, what's happening there? And so I started with John asking him to really embody that energy, let all of that tension and all of that pressure come in. And I'm going to ask you some questions. And I want you to answer from that place of tension and pressure. And so what we found from that was that the assistant's job was really to keep things under control. The goal for this part was to have things be as routine and as predictable as possible so that John could go through the day without ever being noticed by other people. And his mom had mentioned something about this when she had referred him about he had suddenly gotten quite rigid and would get really, really distressed if things went off of the typical routine or what he was expecting to happen. And it turns out the fear that was behind that was this part was worried about, if people notice me, if people see me, they're going to start asking questions and I'm going to get taken away. And when we had first started, this didn't make sense with what I knew about John and his history. It didn't make sense with what his mother had shared with me about his history. But instead of sort of pushing for what does that mean, staying really curious about, okay, so that this assistant is really worried about you getting taken away. What else can you notice about that? What else can the assistant tell you about that? Really trusting that what was going to be coming up was going to come up when it was safe for the system to hold it. And so this process of sort of having John really embody that and me asking him questions is called direct access. And so that's where it's me, the therapist in self-energy, talking directly to a part. And for a lot of clients, this is kind of how we start. And then over time, if clients are sort of comfortable and inclined towards this way of working, it will transition into the client actually doing the work internally. And so with John, this clicked quite quickly. And so it moved over time from me talking to the part to me saying to John, so if you go inside and really notice that tension in your hands and that pressure in your eyes, can you ask that part of you what it's concerned about? Can you ask that part to tell you what it needs? And John would go inside. So sort of often his eyes would close and he would sort of go in and it would be very quiet for a little bit. And then he would come back and say, this is what it said. This is what I'm hearing. This is what I'm experiencing. And this is called the insight way of working. And so there's different ways, and we transitioned into insight. And when you're doing that with a client, there is a lot of quiet in space. There's a lot of space because the client is doing the work internally. It's the client's self who's engaging with the part. It's not necessarily the therapist anymore. And so on the next slide, we learned from this assistant part that there were two parts that it had a major problem with. And it turns out, as it often is, these are firefighter parts who similarly were trying to help John, but were going about it in a really different way. And so he had one part that was called the nothingness. And this was the part that was aiming to just settle everything down and pull John into this fog. He would describe it as sort of this like white oblivion that it was wanting to pull him into. And when we got curious about, what happens for that part that it really wants to do that, this is the part that was using alcohol and marijuana to try to really subdue him. What triggers that impulse? We learned that there was this other firefighter part of John that he had named the Hulk. And this was that part that felt very aggressive, this very out of control, hostile energy. And this was the part, John realized, that had sort of taken over him when he had threatened to kill his teacher. This part had absolutely been triggered by something, and the only way that it knew how to protect John was to get the most aggressive that it could. And the nothingness part was terrified of that energy and the consequences. So it was trying to really subdue everything. And then the assistant part felt so frustrated that neither of those things were in alignment with doing things predictably and in a routine way. And they were getting the client in trouble. So he was no longer off of the radar. And getting to know both of those protector parts more, what we kept hearing was there's a real fear of being taken away. And on the next slide, we spent a lot of time with these parts. We really wanted to understand everything that they had been doing for John, what was motivating them, and understanding what were they afraid was going to happen if they stopped doing their jobs in the way that they were. And the fear for everybody was we're going to get taken away. And so we really sat with that. This took several months of work to really feel like John has had his self fully connected to and understanding what was happening for those parts. And we started then to give them the idea that, like, I know that you have been doing it this way for a really long time. What if there was another way that you could do things? Like, if we were able to alleviate this fear of being taken away, maybe you could do something different. And the parts eventually were open to the idea that John was capable of going in and addressing that fear. And so they were going to soften back. So we got their permission to really work with the part that they were all so focused on protecting. So from there, we went and we worked with the Exile. And this part he named the little guy, and he saw him as his own self, but 5 years old. And so it turns out that this part of John was holding the memory at the end of his parents' marriage. When he was in kindergarten, his parents had had a very tumultuous, very difficult relationship that escalated into domestic violence. And this part was holding the memory of waking up and hearing his mother screaming and going downstairs, and his mother was beating his father and struck John across the face. So he had a big gash and a bruise across his face. And his mother sent him to school the next day, and he had a teacher who said, "John, what's happened to your face?" And this part was holding this memory of knowing that something was going to happen if he told the truth about what had happened to his face. And later that day in school, or at the end of school, his mother and his grandmother came to the school, and his mother told John that he was going to have to go and stay with his grandmother. And John's mind, this part of him, connected having to go with his grandmother and be separated from his mother with the fact that the teacher had noticed that he had been hurt. And it was this intense terror at being separated from his mother and what was going to happen to her if he couldn't be with her. And so this part was frozen in the car of his grandmother, seeing his mother becoming really, really hysterical and screaming as he was driving away. And so it turns out that what was happening behind the scenes was that John's mother had decided to leave his father. The last straw was him striking John. And she was getting everything together for them to be able to go and to go somewhere safe. And she needed John to be in a safe place while she was figuring that out. But that didn't connect in his mind. That wasn't told so clearly to him when he was actually 5 and this was happening. And so all of that pain, that intense sense of betrayal by the teacher, this idea that this person is not trustworthy and I am completely helpless to take care of my mother, to be safe myself, all of that had gotten put on this little 5-year-old part of him that was holding all of that just caused this immense anguish. And so all of those other parts, the assistant, the nothingness, Hulk, they had been working to keep that out of the system. And it turns out that what had happened was when he went into high school, there was a new teacher that he had met who reminded him of the kindergarten teacher. And when he was going back and remembering this experience with the kindergarten teacher, all of a sudden it clicked that, oh, this is what actually set this whole thing off. But because the protectors had done such a good job keeping that memory sort of out of his daily awareness, it wasn't clear initially where all of that had come from. And so with John's self, he was really able to go and witness what had happened to that exile. He was able to sit with the intensity of those sensations and those feelings, and able then to say, hey, do you want to get out of the car? Can we go somewhere else? And this part wanted to go to the playground. There was a neighborhood playground that it really wanted to go to. And so when we were able to get the part safely to this playground, in the imaginal space, we didn't really go to a playground. John was able to ask that part, what is it that you would like to give up? What burdens do you not want to carry anymore? And because John had really witnessed what had happened to that part, it was ready to let go of those memories, that sense of betrayal, that sense of helplessness. And so when parts give up burdens, we typically offer them the choice to give them up to the different elements. And so John's part, this little guy wanted to give them up to fire. So they built a big campfire and put all of those burdens in there. And then got really curious about, so what do you want to take in instead, right? Nature abhors a vacuum. There has to be something else that's there. And this part really wanted to take in that openness to the idea that people are trustworthy, that it's okay to be spontaneous and it's okay to play. And those are all things that had been missing for John for much of his childhood, because this part had become so burdened by this experience. And so he took all of those back in. And on the next slide, once we had done that, he invited those protector parts back to meet this part who was no longer holding all of those burdens. And it was this massive internal shift that happened for him. And once those protectors were able to see, oh, we don't have to keep this out of the awareness like this, we could do things a little bit differently. They were able to give up their own pain and burdens that had come from taking on those roles that had them so maligned with other people in his life and even in his own system. And so the things like the assistant was able to really take back in the sort of energy of organizing and keeping on top of things, but it didn't have that same rigidity or heaviness that it had previously. And the nothingness was that part of him that was really about relaxing, having fun, but without being disassociated from the experience of relaxing. And the Hulk was this part that had this really important job of communicating assertively. And without self-leadership, that came across as this very aggressive, very out of control way of communicating. But with self sort of leading the way, it was that Hulk part that was able to be really clear and really champion, when he needed to advocate for himself and others. And so he thanked all of these parts. We would thank every part, every session. And then at the end of this work together, when all of these parts had given these things up, we did this ritual. I often will do with clients, we'll have sort of an ending ritual. And for John, what that looked like was he had drawn these beautiful postcards that illustrated what each part looked like to him in their most natural, most unburdened state. And he brought them in and sort of had arranged them and pinned them in this way that had the image of self in the center and the other parts around it. And so that is the process of IFS with a client. I hope that answered some of the questions that were coming up about the actual process. Kara, I don't know if it's good to pause here and answer a couple of questions because I know we're coming up on time, or just quickly run over the 6 Fs.
Let's run over the 6 Fs. We do have quite a few questions, but we'll talk about that. Let's go over the 6 Fs.
Great.
I think it'd be helpful for everyone. They are loving. They love your example, and thank you.
Okay, good. So the 6 Fs, this is what we use to help clients get to know a part and build that self to part relationship. So when I was working with John, this is really what I, as the therapist, aside from holding self energy, this is a great deal of what it is that I'm doing. So they all start with F. There's a lot of 6 Fs, 8 Cs, 5 Ps, those kinds of things. If we could go to the next slide. It starts with finding the part. So when we have identified a part that we want to work with, we want to find it. Where is it in the body? Is it around the body? How is the client experiencing it? Where is their attention called to? We want to just sort of identify where it is in or around the client. And then in the next one, we want to really focus on that. And so this is one of the most important steps because it's what allows the client to actually unblend from the part and allows that self energy to start to come through. So I will say things like if a client says, I really feel it in my chest, I want to know, how do you feel it in the chest? Is it heavy? Is it light? Is it tense? Is there a color that comes up with it? What emotion or thought comes up as you're really focusing on that? Are there sounds that you're hearing? Are there memories that are coming forward? And this is the part that is sort of like in meditation or mindfulness, where we go from thinking our thoughts to observing our thoughts. That little bit of space is what is allowing that self energy to come in. So I spend a lot of time on tell me everything you can notice about where that part is for you. And then we want to start to flesh out that part. And this is where we're going to get curious about, what does that part do? How does it feel about what it's doing? What does it want for you? What's motivating it? What's their name? What do they look like? All of those things. So we're sort of building out the character of this part. And when I do this, I always start with the question of, what does this part want you to know right now? Because so often when we are first starting to engage with our parts, they have been waiting for us. And so there's often things that they want to say right away. And so giving them that chance of like, what does that anxiety want you to know right now, can help alleviate some of that tension before we're getting into more of, how does it sort of see itself? How does it work in the system? And then we always want to be checking in about, how does the client feel towards the part? And this is so important because if the client says, if, for example, a client has this anxious part, if I say, how do you feel towards that anxious part? If the client says something like, I feel so much compassion towards that part. I'm really curious, to know more about it. those are some of the 8 C's. So we know that there's self energy on board, and that's what we want. We want self communicating to part. If they say something like, "Ugh, I just am so annoyed by this part. Like, why do I have to be so anxious?" That isn't self energy. And so we know that another part has come up, and we either want to ask that part to step back, or if it's not able to, we want to turn our attention and now work with that new part. And so if we've got self energy on board, this is where we are really building up that self to part connection. We want to know, does that part sense the client's self energy? What does the self feel led to say to the part? Can it extend any of those qualities of self energy to the part? And how does that land for them? So I spend a lot of time in that space of sort of befriending and really being between self and part, because this is, once that relationship is in place, that's when the healing and the unburdening can happen. And so skipping forward one more slide. Once we have that relationship, we want to get really curious about what is this part afraid of? What are its fears? If it stopped doing its job, what might happen? Because this is going to give us a sense not only of how its role is in the system, but it's going to give us a sense of what it's protecting. And so once we can understand what it's trying to protect, we can address those fears more concretely, and we can start to offer hope that if we could alleviate what's underneath that this part could give up this job that is often very exhausting or very scary for them, and take on something that's more natural and organic for them. So on our very last slide, there are a number of different ways that you can do this. So if you're doing it, very, very beginning, it might be direct access, where you ask that client to really bring that energy in, and I'm going to interview you like you are only that part. Or it might be more insight oriented, where you're sort of asking those questions and supporting the client's self through that process with their part. When I'm working with younger kids, a lot of times I will have them either create or bring in or find objects in my office that represent parts to them. Having them concrete can be really helpful. And so if, for example, if they've got this really anxious part, they might bring in a little figurine that they're like, this is what this feels like. And then we're going to get curious about that. And having that externalization can sometimes be really helpful, as well as having that visual. It can make it a little bit more concrete for people. The other one that I really love is having clients journal from that point of view. I found that teenagers, for whatever reason, tend to do quite well with this one, where I'll say, that really anxious part of you, we've worked on figuring out where that is and what that feels like. I want you to go home and answer this question from that part. And I'll give them just one of the things. So maybe something like, what is your job? What do you do for the client? What are you afraid of? What would you like to be doing instead? Giving them one question and having them journal from that place. So really giving that part of voice, and then they can bring it back and we can work with that. So that is the gist of the 6 F's. I'm sorry that we're over time. I hope that's okay. And I'm happy to take questions if there are some.
Yeah, there are, we may need to do a part 2 heart. So
Okay.
thank you so much for your
Of
time.
course.
And for being here. There's a little survey that Connor has been chatting in. Please, if you can complete that, please do, and recommend a part 2 if you'd like that. We have some upcoming events I'm going to talk about, building on the strengths of youth who have endured hardship. Dr. Ken Ginsburg is going to talk about resilience on March 30th. We have grief and transition age youth, where Hart will join us again, because one of the areas that she's really, really good in is grief. And that's actually how I found her, writing for a blog around grief. And so Hart will be joining us again April 13th to come back. Social media use and mental health among sexual and gender minority youth, Thursday, April 14th, trauma and addiction. We're going to have a 2-hour training with Jan Winhall on Wednesday, April 20th. Thank you everyone for joining us. I'm sorry we didn't get to your questions. A lot of your questions we're going to try to answer in different ways. So some were about how do we create a safe space. We're going to be doing some skills and action around creating safety. There were some questions around documentation, and some other questions that I think we can answer in different ways. And and maybe we have to do a part 2 of IFS. It is an extensive training. There is an institute. I recommend you look into it if you're interested in getting further training. So this is really a very, very quick, condensed kind of Cliff Note version. And Hart, you did an amazing job. I think you got us all excited about IFS and all of the, especially that beautiful case study. Thank you so much for sharing that. What beautiful work. I'm sorry, everyone, we didn't get to more questions, but reach out to us if you have any thoughts or other questions that you need to be answered, and we will make sure that that happens. We hope you have a wonderful day, and we'll see you another time, okay? Thank you, Hart. Any last words?
Thank you all for being here. Have a great day.
Okay, take care, everyone. Bye-bye.